Hi everyone, my name is Shrishti Sharma. I'm a board certified preventive medicine physician and I'm here to talk about all things prevention, all things screening, and all things health. So as a clinician, I take care of patients who have HIV or who are at risk for getting HIV. The US Preventive Services Task Force or USPSTF has very specific guidelines on using antiretroviral drugs or drugs that act against HIV to prevent people from acquiring HIV in the first place. So why is prevention of HIV so important? Here are some numbers. Globally, there are over 40 million people living with HIV even today. There are more than 1 million infections happening every year, and a little more than 500,000 people die of HIV and AIDS every year globally. In the United States, there are a little over 1 million people living with HIV even today. And since the time of the beginning of the pandemic in 1981, over 750,000 people have died of HIV and AIDS in the United States alone. 80% of new infections of HIV occur in adolescents or adult men. Of them, up to 70% are men who have sex with other men. You are at a higher risk for HIV if you have had unprotected intercourse with someone who has HIV, if you have had a sexually transmitted bacterial infection in the past 6 months. These infections include syphilis, gonorrhea, chlamydia, among others. If you're engaging in unprotected intercourse with individuals or groups who are at a higher risk for HIV, these include men who have sex with men, men who have sex with men and women, transgender women, individuals who inject drugs, individuals who share drugs. If you are sharing needles yourself, if you're engaging in unprotected intercourse with someone who has transactional intercourse, or if you yourself are an individual who has transactional intercourse. All of these factors put you at a higher risk for HIV. There are some very specific and highly effective medications that can be used to prevent HIV if you are at a higher risk. The 3 drugs that are currently used for pre-exposure prophylaxis for HIV are tenofovir disoproxil fumarate, an emtricitabine combination, or Truvada. The other oral drug is tenofovir alafenamide emtricitabine combination, or Descovy. And the third drug is an injectable cabotegravir, or Apretude. I am not going to repeat those chemical names again. I'll just call them by their brand names because those are the ones that are currently available. PrEP medications are offered to all adolescents and adults who are at least 35 kilograms or 77 pounds and at a higher risk for HIV. Oral Truvada and injectable cabotegravir can be used by all individuals who are at a higher risk for HIV. Descovy at this time is not approved for use by people who have receptive vaginal intercourse. So how is pre-exposure prophylaxis or PrEP done? As I mentioned earlier, there are 2 ways to take your PrEP. One is orally and one is through injectable ways. Oral PrEP is done with Truvada or Descovy. Both of it are popularly used as a single daily dose. That is, you take 1 pill of Truvada or Descovy every single day for as long as your risk of exposure is high. There's an additional way you can use oral PrEP. This is called the 2-1-1 method. In this, you do not take an oral PrEP every single day, but if you know that you are going to be exposed to HIV within the next 24 hours, then you take 2 pills of Truvada. Then after the exposure, you take a single dose of Truvada again. And then 24 hours later, you take another dose of Truvada. All of these oral medications have to be taken in consultation with your physicians. Oral PrEP is great. If taken regularly and as directed, it can prevent over 99% of HIV infection among those who are exposed. Having said that, Some people find it really difficult to keep on schedule with daily pills. For them, there is a second injectable option. Injectable PrEP is called Aptitude. Aptitude is initially given as a monthly injection, but then once you take 2 monthly injections, you can transition to 2 monthly injections. That is, you take injection number 1 in month 1, injection number 2 in month 2, and after that, you can take Aptitude injection once every 2 months. Again, this is not something you can take at home. You have to go to your doctor's office to take the injectable PrEP. Injectable PrEP or Aptitude is also equally good. That is, they are capable of preventing over 99% of HIV infections among high-risk individuals. Note that none of the PrEP medications are currently approved by the FDA to prevent HIV among people who inject drugs or who share needles. Having said that, the CDC does recommend the use of PrEP even among individuals who share needles or who inject drugs to prevent the transmission of HIV. The FDA has allowed the use of these drugs among people who are pregnant or those who are breastfeeding. It goes without saying that none of the PrEP medications can be used to decrease your risk of other sexually transmitted infections or STIs, and you do have to rely on conventional methods like use of condoms or medications to decrease your risk from getting them. Additionally, if you are at a higher risk for HIV or STIs, it's always a good idea to get yourself tested every 3 months or so. So in summary, if you are an adolescent or an adult who is at a higher risk for HIV, do talk to your doctor about pre-exposure prophylaxis or PrEP and discuss what option might be best for you. Until next time, prevent, screen, and stay healthy. Thanks for watching.